So let's move on to one of the comments that landed Professor Glenda Gray in hot water, a claim that there's actually been an increase in child malnutrition cases at Baragwanath Hospital. So as part of its lengthy hit back, the Health Ministry was quick to deny this. But there is something to be said about the lockdown having an impact on children's access to food. Now, what is the state of child malnutrition in South Africa is one of the many questions many are asking. Activist and former Section 27 Director Mark Heywood wrote a strong opinion piece on the subject. He joins us now via our Skype line. Mark, it's great to have you with us. Thanks very much for making time. So in many respects, perhaps as a start, some people might say that the success of the lockdown could be measured according to the impact it's had on the most vulnerable people in our society. Based on that, do you think we've done a good job so far?
I'm afraid I don't think that we've done a good job. I mean, the lockdown has had its benefits in terms of flattening the curve and reducing the number of new infections for a period of time. But where we failed really is to mitigate the socio-economic impact, and food is a case in point. During the period of the lockdown, there's been a huge increase in food insecurity. Food insecurity leads to hunger. Hunger leads to malnutrition, particularly in children. And in its most extreme form, malnutrition leads to severe acute malnutrition, which is what Professor Gray was warning about and which can be fatal to our children. The difficulty at the moment is that we're not measuring it, and also that hospital admissions are down across the country and across Gauteng province. So although we know it's there, we are not treating it and preparing for it properly.
And I would have imagined the president would have been warned about this before entering into the lockdown. In fact, my understanding is that in some respects you were part of some of those conversations. What was said during that period, and to what extent do you think the president did heed some of those warnings?
Well, when the lockdown was being considered, I mean, I was part of a conversation with senior health experts 3 days before the lockdown, and what the experts said was that the lockdown is necessary, but it needs to be accompanied by two other critical interventions. One was the scaling up, massive scaling up of testing for COVID-19, accompanied by contact tracing and isolation, and the second was what we call socio-economic mitigation. So we knew that the lockdown would cause hunger and that it would cause suffering, so we needed to be in a position to quickly introduce measures to limit that hunger. As it was, it took more than a month before food parcels started to flow to some families, before there were increases to the child support grant. So we allowed this crisis of hunger to begin to develop in a way that wasn't touched. And the reason that I say we should have known about it is because our country, 27% of our children before the lockdown suffer from wasting, which means that they are nutritionally deprived, even when there's normal economic activity. So we should have foreseen that when you stop economic activity, that threat would grow even greater. And severe acute malnutrition, which is what Professor Gray has been talking about, is something that again is persistent in our country because of inequality. Even in inverted commas normal economic circumstances, it can only get worse where people are deprived of income and therefore deprived of food. So we had to have a plan. We had to have a plan. And I fear, and I think the experts, pediatricians fear, that in the months ahead we are going to see a rise. And what we are appealing for is that we put in place measures now to cater for that crisis.
Yeah, and in some respects, government, one might say, has attempted to try to put in those measures, especially in the form of increasing the child support grant. But a point that was well made is the fact that this grant actually increased per adult beneficiary than per child itself. How is this likely to perhaps create the impression that we're doing something when in fact we're not doing near enough to try and mitigate some of these issues you've raised?
Well, you've said it. We're doing something, but we're not doing near enough. So the child support grant was increased after pressure from children's advocates But as you've explained, it was not increased per child beneficiary. It was increased per adult beneficiary. So it may mean that, let's concretize this, that in a family, there's one adult who has responsibility for 3 or 4 children. The 3 or 4 children don't each get an increase. The increase only goes to the adult caregiver to look after those children. So at the end of the day, it's very, very little. The other complaint that has been made by experts is that, the food parcels that have been put together, and we're very grateful, and it's an important intervention, but the food parcels contain only 50% of what's called the caloric content, which is the basic nutrition that a child needs to be able to develop and grow in a healthy way. So again, it shouldn't be rocket science. These are things that we are constitutionally, legally obliged to care for, but they're also things that we should be caring for if we are a caring nation that care particularly for those who are most vulnerable and most in need and most unable to look after their own needs at a crisis point like this.
Yeah, you're absolutely right. You speak about care. I mean, according to the Children's Institute at UCT, a part of the issue here is not the fact that there actually isn't enough food to go around, but it's got to do with distribution and access. And this is, there are constraints due to the high poverty rate that we're experiencing in our country. I mean, does this in some respects show a lack of care on, people who are in charge of these systems, at least insofar as they, are able to safeguard some of the most vulnerable people in our society?
I'm afraid I have to say so. At best, it indicates a carelessness because we knew about this problem. I've been speaking in preparing that article to some of the most senior pediatricians in the country. There was a problem already. I mean, we are so-called a middle-income country. We are not a country with actual food shortages like Zimbabwe or Malawi or some of our countries to the north of us. We have sufficient food in this country for all people. As the Children's Institute says, the problem is how we distribute that food and what we do to make sure that those who are most vulnerable get the food that they need. I mean, it's a shocking fact. This is what the pediatricians told me, that in the 1990s, severe acute malnutrition was almost non-existent. Then it came back in the early 2000s because of the HIV epidemic, which contributes to severe acute malnutrition. Then with the introduction of antiretroviral medicines, we were able to bring it back down again. But we sit with a persistent level of 2 to 3% of all admissions into our pediatric wards of severe acute malnutrition. That is outrageous, It shouldn't happen in a country like this. I mean, you and I, Ayanda, can use words like severe malnutrition and the percentages and the numbers, but you need to understand the pain and the suffering of a parent and a child that is deprived basic nutritional content. The pain now, but also you need to understand that stunting and wasting is not just something that affects a child for a few years. It affects a child's whole development and growth. It affects the child's intellectual development, it affects the child's physical development, and therefore it further entrenches the inequalities that already exist in our country. This is why it needs to be a matter of priority for all of us, particularly the government.
So as we reached the end of our discussion very quickly, Mark, I mean, we're expecting the social cluster media briefing to take place later today. What are you hoping will be said, particularly in response to some of these challenges that you've outlined?
Well, I hope that they will have, and it's not just Professor Gray, it's other health experts, I hope that they will have learned from this and listened. And, in the article I wrote, not based on what I think, based upon what I've been told by health experts, there's a plea that we conduct surveillance for malnutrition in children, that the community healthcare workers who are currently doing a heroic job screening for COVID-19, HIV and TB also be equipped to screen for malnutrition in children, and then that our social support interventions, be it in grants or be it in food parcels, have to be informed by science as well. And when you say those interventions need to be informed by science, the amount of money that you top up a grant by has to take into account what is the minimum poverty line when it comes to food, what's the minimum amount of money people need to avoid malnutrition or, in the family. You know, the science is as important to issues of hunger and food insecurity and nutrition as it is to COVID-19 prevention and other aspects of this response. So when we talk about being guided by the science, we have to be guided by the science in every aspect of how we deal with this crisis.
Absolutely. It's a point well made indeed. Thank you very much for your time. I certainly appreciate it. Mark Heywood is an activist in the country, also happens to be the editor of Maverick Citizen. Certainly appreciate your insights.